Hi you guys, my name is Dr. Cade and I'm here with the one and only Dr. Duane, and today we are going to talk about pain. Pain is such a big label, pain is such a big motivator, pain is a big thing that a lot of folks deal with these days, and it's a motivator to have people call our office. But first and foremost, we are not pain doctors, so starting this talk here, I want to make sure that you're looking at this through a little bit of a different lens of things that you've heard before. So Dr. Duane, what does a mainstream model look like? When somebody has a headache, when somebody has back pain, when somebody has wrist pain, what is the mainstream model of what people are doing right now?
Well, I feel like you go the kind of the easiest route there. When a patient comes in and says, hey, I hurt right here, you know, they're going to delve in and they're going to go and MRI it. They're going to cut it and slice it and just look directly at that shoulder. And if they don't see anything there, then they start to go, oh, whoa, now what are we going to do? So I think usually they're looking at the symptom and they're looking for, you know, what's the one solution for it? What one pill can we do, or what one surgery, or what one thing? If it's just in the shoulder, it's got to be a rotator cuff injury. So I feel like, as opposed to taking a step back and looking at the subject or the patient globally, they're looking almost too fine-tuned.
Yeah, it's really, really easy to do, and I think it's important to note that there's a thing that exists called referred pain. Just because it hurts here, that doesn't mean that the problem necessarily has to be there, right? And when we become laser focused on that spot and try to quiet it down or numb it or just shut it up, eventually what happens is we're avoiding the actual problem, where the actual, not the symptom, the actual problem is, and sooner or later we really end up having to deal with it. One of our favorite quotes is that you can't negotiate with Mother Nature. You're going to have to deal with these things one way or another. So how do we do it different in our office? Our office is all about root cause resolution. It's trying to identify what is actually causing these issues. And again, whether it's a headache or sciatic pain, whether it's carpal tunnel, we'll let you name what that pain is. Our job is to figure out why it's there and what's causing it, and how do we actually correct the root cause of that. And so the root cause of pain really is inflammation. That's such a hot word, so many people think about it. And if you've ever sprained your ankle before and you've had it swollen up or jammed your finger, that short-term acute inflammation is really good. The body is flooding that full of healing molecules and white blood cells and all these different things to actually heal that. But chronic inflammation is what is bad. And chronic inflammation is, again, what leads to pain. Well, again, what's the root cause of inflammation then?
Yep. And what tissues are being affected as well. Most of the time you think an ankle, you think, oh, it's just got to be a bone. So then you got to start looking at, is it nerves? Is it blood vessels? Is it ligaments? Is it bone? Is it joints? Whatever it may be. And that's where you start to break it down and find out what's the root cause. It's not always one of them. It's most of the time it's multiple different areas there. And it could be from past injuries that affected something higher up in the chain. If it's a gait type symptom, it's going to affect multiple different things, and the longer you have it, the more things it can affect.
Yeah, absolutely. So it's really important to not get so hyper-focused on a small little symptom. It's important to step back and look at the big picture. How is the body adapting to this, and again, what is the root cause? So again, for us looking through this, the root cause of that inflammation is usually stress, right? So there's mental stress, there's chemical stress, and there's physical stress. We just talked about a couple examples of physical stress: rolling your ankle, jamming your finger. What are some examples of mental stress? What are some examples of chemical stress that can lead people to experience pain?
Well, like the mental stress right now, the uncertainty of when will our country get back to normal? When will we be going back to work? What's the current health situation going on? And am I healthy? Am I at risk? Those are stressors that are in a daily life where, whether we know them or not, they're constantly around us and we're constantly aware of them, and we're bombarded with them with questions and, hey, how you doing? How's the family? How's this? We're always aware of it. So those stressors, we deal with them in different ways. Some people get pain from them. Some people get anxiety. Some people, we all deal with it in different ways.
So that's mental stress.
Yep.
What about, give them some examples of chemical stress?
So
what are some chemical things that can cause pain?
Yep. So I mean, big ones for me that I'll see with patients is they don't even know they're doing it daily. Maybe it's a glass of wine at night, or maybe it's something in their house. They just moved into a brand new home, and all the chemicals, the off gases, the paints, the adhesives, all of that stuff, that can be a chemical toxicity as well.
So mental, chemical, and physical, all of those things, if done the right way, equals a healthy body. If any of those things are done the wrong way, they can create inflammation and over time create pain in the body. And so again, when we get back to that mainstream solution that most people are going through, and I drive by, I don't know, right now I think it's about 5 or 7 different Walgreens and CVS's, the one solution for all those different causation factors is what? Medication, right? And you take that medication to numb down the pain or to completely try to shut it off. But when we don't actually address the mental pain, the mental stress, the chemical stress, or the physical stress, over time we're going to need more of that medication to continue to numb it. And that's why most people, most Americans are on countless medications, right? 2, 3, 5 different prescriptions. And that problem continues to get worse. So again, that quote, you have to deal with it at some point. You can't negotiate with Mother Nature, really is true. So Dr. Duane, what are some ways that we can help identify with each patient that comes in the door? How do we figure out which one of those things is leading to their inflammation? Which one of those things is leading to their pain? What are some diagnostic tests and questions that we go through with our patients?
Well, I think the biggest thing is our bodies are amazing and they're meant to tell us what's going on. So you have to listen to your body, and you can't, I don't want to say shun them, or you don't want to pull the cloth over on them. You don't want to mask any of those types of symptoms, because that's your body saying, hey, there's a fire here, there's something going on, I have inflammation, whatever it may be. If you shut that down, you're potentially making it worse in the future, or you're going to have more issues in other areas because you've been compensating. So the biggest thing with patients is we go through a big thorough history, and we say, when did this start? When did it come on gradually? Did it come on from an accident? What happened? That is so important. And if you skip that step and you just go right to treatment of the symptom, then you could potentially miss, a very, very simple type diagnosis.
Yeah. So stop putting, a piece of tape over the check engine light on your car, right? Or cutting the fire alarm at your house. We want to figure out, smoke is a symptom, where's the actual fire? And again, that's what we're trying to do through that detailed questionnaire. You do a posture exam. I saw you the other day doing some neurological testing, testing somebody's muscle strength.
Motor strength,
right? So it's not just where they're feeling it, it's also where there's potentially a loss of function.
Yep, exactly. So function is a big thing, and you can see that with the naked eye. You don't need any MRIs or x-rays or anything like that yet. It's good to see that, because if that stuff's there and you take care of that first, you can potentially see those symptoms go away without having to do a lot of really expensive tests. So definitely the functional, the movement, the coordination. That strength is different than just having coordination. You can be very strong and be able to lift something very heavily, but if your muscles aren't coordinated and they don't turn on and off at the right time, that's where balance and coordination disorders come in, and then you get injuries, repetitive injuries that just keep coming.
Yeah, it's been really cool to see you bring people through those exams and try to highlight where those weaknesses are with people, because again, you see somebody who's very strong and then fall short on that coordination test, and you go, aha, we got something here, this is something that we can work with, this is something that we can correct and dial in, and sooner or later that person's not only feeling better, but they're healing and functioning at a much higher level, which is rewarding for us, of course, and rewarding for our patients. So let's see, what else can I ask you here? What else can I ask you? When we talk about pain, beyond just, again, as chiropractors, we look at the neurological system, we look at the biomechanics of the structural, the muscular system. Well, a lot of times patients try to separate those. Is it a muscle problem? Is it a bone problem? How are all those things connected?
Well, if you think about it, our brain controls everything. So, I mean, that's primarily your nervous system is communicating with muscles, and your muscles are communicating back with that. You're getting feedback from the environment. So all of that has to work properly, and when that doesn't, whether it's from a head injury, whether it's from sitting all day long and not activating, or causing those receptors in the body to move or be engaged, that's when you start to lose function, and where we start to get poor posture, we start to get depression, anxiety. When we don't move, our brain is not activated. Even though we're sitting and doing something as a job, we're only activating really one area of the brain. We're not activating our primary motor receptors, which that engages the entire brain and fires it up and gets us feeling good.
Yeah, I love it. Yeah, that motion is such a movement and information for our brain to function and to continue to grow. So let's see, what else can I ask you? So beyond, again, just looking at the musculoskeletal system, the neurology center of the body, and how chiropractic influences that, there are other things that we can talk about. One of the things that I love sharing with patients is nutrition, right?
Yes.
So food can play a big role. We talked already a little bit about toxicity. Again, when those things are done the right way, it can help the body heal a lot faster. So even when somebody comes in with a headache, we're not just adjusting them and moving a bone back in place. We're doing, again, some muscle work. We're asking that person about potential food sensitivities or other chemicals, cleaning products that they're coming into contact with. And we don't ask our patients to be perfect, but the more of those things we can check off our list doing the right way, the faster that patient's going to get better, right? And I think it's so important, in one business model, in that mainstream model, you're on medications for life. Our big goal is to equip you with a toolbox so that even when you're not here inside these four walls of our office, you're still able to move your health in the right direction, not just for you, but for your whole family.
Yep. And also with those foods or the toxic stuff that they're coming in contact with, it's not always about what we need to remove, it's about what we need to add in there as well. And there's multiple different types of supplements you could be taking. We could be taking all of them, but sometimes you only need to take a handful to help with the root cause, not just the symptoms. Sometimes people just take, you know, the magnesium because I got muscle cramps. Well, what if you have XYZ in front of that? That's, you know, a secondary thing is that. So that's a big thing that we try and decipher here is, you know, what's the best thing for you to be taking for the real problem.
The best bang for your buck, that's what it's all about for us. So I think this wraps up our initial talk on pain. We've got some ideas here to talk a little bit about the root causes of headaches, sciatic, pain, scoliosis, postural assessment. So we're going to talk a little bit more about that. But for now, what we want to leave you with is that if you are dealing with pain, it's important to go beyond just that symptom and look at inflammation. What is the root cause of inflammation for you? Again, we've laid that out at the three different types of stress: mental stress, chemical stress, and physical stress. Most of the time, it's not one of those for a patient. It's a combination of all the above. And the diagnostic tests that we have in our office are specifically made to identify what that combination is for you. And our team of professionals here at LifeStrength Health Center, it's important for us to put together a detailed plan that makes sense for what you're dealing with. It's not all of these different problems with one solution. It's not how that works. And of course, I think you're probably here and you know that. So my name is Dr. Cade. I hope that we get a chance to meet you. Again, this is Dr. Duane, and get down to that root cause, you guys. Thanks for joining us.
Thanks.